The coronavirus continues to make headlines this morning. 170 people are dead in China and 7,700 are now infected. The U.S. infection count remains at 5. And joining us now from Mass General Hospital is Dr. Ali Raja. Good morning and thank you for joining us.
Good morning, Sarah.
So, Dr. Raja, we've seen a lot of these health screenings at Logan Airport and other airports around the country. So how concerned should we be about the virus here in Massachusetts?
It's a great question, and one that all my friends and neighbors have been asking me as well. The fact is that the CDC expanded screening to 20 airports around the country. They didn't target Boston Logan in particular. We should be concerned, but we shouldn't be worried. There's no reason to credibly think that Massachusetts is at any higher risk than any other state in the country.
And we're seeing cases growing exponentially over in China. What makes this virus pass so easily?
That's the big question that we're all working with right now. What we're not sure about is whether the exponentially increasing numbers, like you said, Sarah, are because China is reporting more, or whether or not testing has actually gotten better and there's more screening done, so more patients who might have been missed otherwise are coming back positive, or if it's simply spreading faster. That's exactly what the research is into right now, and that's why the WHO is calling an emergency meeting today.
Throughout the last week or so, we've seen a lot of video of people wearing masks while walking through airports. I've also seen people in my own neighborhood grocery store wearing masks. In your opinion, is this necessary?
You know, I've seen those people as well. There are actually two kinds of masks. The first is an N95 mask. Now, this is the kind of mask that we here in the hospital wear and other healthcare workers wear when we've got somebody who we're worried about the coronavirus or any other flu with, when we have airborne precautions. These masks come in different sizes, and you have to be fit tested every year. If you have a beard or if your facial shape changes, they won't fit anymore. So it's really important to know how to put this on and off correctly. And that's why these masks are effective. The masks that I've seen a lot of people wearing are like this one, which quite honestly is little more than a dust mask, but you can find it almost everywhere. This mask is really great for stopping droplets from hitting your face, but as you can see, it doesn't fit nearly as well. It doesn't have a seal, and quite honestly, there's no evidence to say that it helps at all. We would not wear this for somebody who's actually sick. The important thing to remember is if you are actually sick, this kind of mask can help other people from getting your infection as well. So instead of going to the store and cleaning them out of these masks, what I recommend is that people save them for folks who actually need them, who have illnesses that require them to wear this mask.
That show and tell, incredibly helpful. Thank you so much. But doctors have compared the symptoms of the coronavirus to those of the flu. Is it like the flu where if you're relatively healthy and you get it, you're likely to be able to survive?
That's exactly right. So far, while there have been 5 cases in the U.S., the patients who have unfortunately died from coronavirus have all been in China. What we know so far is that the mortality of the coronavirus, the novel coronavirus that we're talking about now, is actually lower than SARS or MERS, and far lower than the influenza that we're actually seeing all across the U.S. right now.
That's right, and the flu, that is really the virus that is hitting hardest here. You're on the ground there at MGH. What have you seen as far as the number of cases and the severity this season of the flu?
That's right. As you mentioned, Sarah, earlier, there have been about 7,800 cases of coronavirus all across the world, but there's been 8,000 deaths from the flu so far in the U.S. alone. That's what I'm worried about. That's what my patients should be worried about. The interesting thing is the flu season is actually about average, maybe a little bit more severe, but not significantly more severe than it usually is. We're seeing a lot of the flu, but about what we'd expect for the end of January.
And the video to the right of you shows a bunch of kids who are sick, and dozens of kids seem to be out this week, at least at my daughter's school, due to the flu. Why are so many kids infected this year, even if they've gotten the flu shot?
You're absolutely right. My kids have been out of school, their friends have been out of school, and it's really hitting hard. The influenza type B, the variant that tends to affect kids a little bit more, started a little earlier this year. We usually see a big spike in the type B influenza in February or so, but we've been seeing it for over a month. It's not quite sure why exactly that's happening, but a lot of it may be due to the fact that kids are notoriously worse at hand hygiene and other precautions than adults are. It's really easy for type B, once it gets a foothold, to really spread amongst the pediatric population.
All right, Dr. Ali Raja, thank you so much for your insight and your tips. We appreciate you, and have a wonderful day.
Thanks, Sarah.
We do have continuing coverage on our website. You can find everything from the CDC covering things like prevention and treatment. Just head on over to boston25news.com and click on the More tab.